I really like being an orthodontist. In fact, I always say that I went through dental school to become an orthodontist. So I like it a lot. It's great, being able to help a lot of people. And, the smile, I think it's like the most important thing in someone's face. It not only expresses whatever people feel, but it also, it's part of what makes us good looking, I guess. I was born in Caracas, Venezuela. It's on the northern part of South America. I grew up there. I lived most of my life in Venezuela. However, I spent 3 years of my life living in upstate New York. My dad studied at Cornell University, so we spent there for around 3 years. So that's where my English comes from, as it's not my native language. I graduated dental school in Caracas, Venezuela at La Universidad Central de Venezuela, and that's my alma mater, and also that's where my mother went to dental school as well, and where she teaches. I have, most of my family actually is a dentist. My mother is a pediatric dentist. My wife is a prosthodontist. My sister is a general dentist, and 2 of my aunts are general dentists as well. So yeah, dentistry runs in our family. In Venezuela, college is part of the high school, so when you graduate, you actually graduate with a bachelor's degree in either arts or sciences. When I graduated when I got my bachelor's in science, I started studying computer engineering. So I went to school for that for about 2 years, and my sister was at the same time in dental school. So I remember, I grew up at a dental school because my mom taught throughout her life. So once my sister started, at first I was like, I don't want to do the same thing that everybody else in the family does, so let's try something different. But then again, I saw what my sister used to do, like what she used to study, and I thought, you know what, maybe this is what I should be doing. So at that same time, I was undergoing orthodontic treatment, so I was like, yeah, this is what I want to do for the rest of my life, which was kind of like a shock because I was doing pretty well in computer engineering as well, but it was worth it. So it set me back a little bit, but it ended up, worth it. I studied at the University of Puerto Rico. It's a 3-year program, really, really good program, very small program. There's only 2 residents per year. It was a huge achievement because they only take 1 international student a year, so I was, fortunate enough to be the one chosen for that particular year. Well, ever since I moved to El Paso, when I first started, it's very different compared to everywhere else I've been in, since I come from a country that's coastal, so there's beaches all over. And then I went to school at another coastal, actually an island full of beaches. So the first time I came here, it was a little bit shocking because it was very dry and desert-like. However, people here are very friendly, very warm, very much like people from home, so it's been super easy for me to transition here. In fact, my wife arrived a little bit after, again, with very little expectations, and we've been pleasantly surprised. In fact, we have decided to settle here, so we now have a daughter who's from El Paso, and that's basically it. We really like it. The best way to, be up to date is not only going to the conventions every year for your specialty, but also always to visit on certain cases with other professionals within the profession itself. So I always like to discuss my cases with the general dentist if the patient's obviously undergoing general dentistry, and also oral surgeons. My wife's a prosthodontist, so you kind of feed off of everybody's information, so that way you're up to date as to what it is that you can offer in terms of treatment for your patients, so that way you can give them, a comprehensive treatment that not only has orthodontics as part of it, but also adds, anything that could enhance whatever it is that you're in the making. As a member of the American Dental Association and a member of the American Orthodontic Association, I receive monthly journals for both, which obviously I read and I enjoy reading. And most of them have different parts to each. So there's like a clinical part, and there's also more of a research part. So it's always good to have both, so that way you can apply them, apply all the knowledge that you get. Here at SmileLife, I believe, the fees that we offer are pretty affordable. We try to adjust and give the patient as many options as we can in order to help them be able to afford treatment. So most of our patients, or most of the people that visit us for the first time, end up starting treatment because we try to figure out a way that they can afford it. So that way everyone has the opportunity to have braces and a better smile. There are in fact some studies that do prove that whenever someone has some alignment issues or even bite issues, getting braces is something that generally impacts them positively. So it is an investment, obviously, but it is worth it. Like everything, we invest in education, and it's to open and be better in life, get more out of life. So it's the same thing. You have a nice smile, it's gonna get you far. So it was a 60-year-old woman, okay, who was a cancer survivor, very self-conscious about, her appearance. She was not a bad-looking lady, but her teeth, she had a lot of spaces. She had a very deep bite in the front, which means that her upper teeth were covering too much of her lower teeth. She was very uncomfortable eating, very uncomfortable smiling. She was extremely shy when she first came in. So it was really hard to develop her treatment plan because there was too much going on. We had missing teeth, we had spaces, we had the deep bite, we had, anchorage issues, many issues. So together with my wife, who actually did her her restorative treatment, we designed a treatment plan for her, which took I'm gonna say about 2 years and a half. She was extremely compliant. She was great, a great patient. And you could see over the course of her treatment how she would become more confident, how, first she barely would say hi. And then, as we started, as she started seeing progress, you would see her smile. She would be, she would hug you whenever she would walk in and things like that. By the end of treatment, it was funny because she's like, all my friends see me and they all asked me if I had plastic surgery. And it was because she was so much more confident about her appearance that, her life completely changed. She, to this day, still, sends us gifts. I remember that she actually brought me a pair of shoes that time. And everybody was like, okay, what's this woman doing? But she was very grateful and very, very, very grateful about the results. So it was pretty rewarding experience to help someone like that. I always tell the patients that health comes first. Obviously, the ortho part of it is associated with health, but it is also more associated with aesthetics. So it is important that the patient visits their dentist every 6 months because we are taking care of, moving their teeth around to give them a functional bite and also aesthetic smile. But we want to make sure that the teeth are healthy. But by the time we're done with treatment, orthodontic treatment is, on average about 2 years. So we need to make sure that the patient sees their regular dentist to get, their cleanings, everything taken care of, and then to find out if there's anything that needs to be addressed during the course of the treatment. We want to make sure that at the end of treatment, the result is good. And I always tell patients, imagine if you have a, a lined, beautiful smile with a bunch of holes everywhere. It's not going to be that pretty. So yeah, it is very important for the patient to be visiting their general dentist as part of the orthodontic treatment. Whenever we're done with treatment, most of the time the patient feels that they need that extra push. So we offer tooth whitening for them because obviously that's a way to get their smile brighter. So most of our patients, after they're done with treatment, request and see if there's any thing extra we could do to make them look even better. So they do decide to go with the teeth whitening as well. I see my duty as finding out treatment plans for patients that go with their together with their expectations, trying to provide them with the result that they are actually expecting. Most of the patients or prospective patients that visit us come to us for different reasons. One of them is obviously the quality of the work that we offer. Also convenience. We have 3 offices in El Paso, so that way, depending on where their school is or where they live, they can, they have options to choose an office that's closer to them. And also, I'm gonna say affordability. Obviously, here in town, we offer, very competitive prices. And again, we try to work with the patients, let's just say possibilities in order to get them, to start and be able to afford treatment. So to summarize, I'm gonna say quality of our work, I'm gonna say convenience, and I'm gonna say affordability. I think it's always a good idea to, give us the opportunity, meet the doctors, okay? Whenever the patient comes here for the first time, they have, certain expectations of what the treatment's gonna be like, what the cost is gonna be like, but it is very important to understand that treatments take, on average, about 2 and something years. So you wanna make sure that the person you choose to do your treatment is someone you feel comfortable with. We try to be as thorough as we can whenever we have an exam, so that way the patient feels comfortable as to what to expect, in terms of time and also how they're going to be treated, because we treat them well.